Let me take this opportunity to tell our listeners they're listening to CIDI 99.1 FM. This is the alternatives. You have choices. And my guest, Carol Faggy, we were talking about reflexology, and now we're talking about craniosacral reflexology, which is also on the feet. So this is all new to me. I've never even heard of this. This is great.
It's new in North America since about 5 years now, yeah.
Okay.
Yeah.
Okay. And you're having a training next spring?
In spring, yes. I'm the only one at the moment qualified to teach the first level in Canada, but Dr. Alderson comes in and teaches the last level once the people have practiced a bit this. And so a lot of people who do this course, the craniosacral, are already certified reflexologists or massage therapists or physiotherapists or osteopaths. Basic reflexology I teach for the Canadian Association as well. You don't need a prerequisite necessarily. So, pretty well anyone can do the course, but they should know that it is a little bit, it does require some study. To be a certified reflexologist, you have to pass 2 exams. We do a lot of anatomy, physiology in the course so that the people know when they're pressing here, they know why, and they know which body part they're accessing. I think of reflexology as an internal massage, if you will, of the organs, because it's a fabulous way of getting to the spleen, the liver, and stuff like that without going on the macrocosm of the body and starting to press points there, which, of course, we do in massage sometimes inadvertently. Mm-hmm. Yeah. So you're offering courses.
Yes. So if somebody's interested in taking a course with you, how would they get in touch with you?
Well, they could go to my website, www.reflexquebec.com. I'd invite people to visit the Montreal chapter website. It's the RAC Reflexology Association group in Montreal. That's www.reflexmontreal.org. And then the Canadian Association is www.reflexolog.org, or you could just Google reflexology and these things will come up.
Sure. Or Google Carol Faggy.
And you could do that too.
I'm sure you'd have a few pages.
As far as I know, I don't have a criminal record.
Great. So tell me, the last thing you wanted to share with us, I believe, was talking about something else that you do, which is an add-on to massage therapy. You were talking about chair massage. So tell our listeners, what is chair massage?
Yes, chair massage is a specific routine the person does. A person sits on an ergonomic chair. Actually, you could sit on a kitchen chair too. It's just not as effective. In an ergonomic chair, the client, if you will, can sit comfortably, slightly slanted forward, and the therapist for 10, 15, 20 minutes uses specific techniques of either acupressure or what we call Swedish massage techniques over clothing. And what I teach is called a kata. It's a 20-minute routine specifically designed to work on meridian points and give energy to awaken the person. So we follow, for example, we begin with the back. We'll just, do acupressure points on the back with the hands, the fingers, the knuckles, the elbows, depending on how much pressure the person wants. And then we move to the arms. We do the neck. We do a little bit on the head if the person doesn't mind, having her hair touched or her head. And usually after 15, 20 minutes, the client gets up from the chair and is ready to get back to her day, go back to work. She may feel a little woozy or, totally relaxed within the first 5 minutes after, but it's been proven in research at the University of Miami School of Medicine that after, in 5 weeks of receiving this for only 10 minutes, those who received the chair massage were better able to compute mathematical equations than those who just sat listening to a radio for 10 minutes without talking. And so again, it's an increase of blood circulation. It's a release of tension. We'll also work muscle points to relieve tensions there. And people just adore it, Usually it's used in the workplace, but I've used it myself in palliative care for the staff, for nurses, for doctors on a volunteer basis. And it's just a great way. You can mix a combination of reflexology and chair massage.
That's right.
If a person has a sore neck back, we do that for 10, 20 minutes, and then we move right into the reflexology.
On the hands or ears.
Or even on the feet. You just move over to the chair next to you. Usually I have all kinds of chairs and tables. So again, and if the person's not comfortable on a chair, if they want to lie down, we have massage tables, or, often people will just lie down on their couch, and it's just so wonderful for that reflexology, because you don't need any props, you don't need any fancy tables even. You just use your hands as your tools,
And there's no oils because it's directly on the person.
Yes,
it's over the clothes, rather, yeah.
Yeah, on the chair massage, yes. And even on the foot, you can, or you don't have to use oil on the foot, because you do acupressure techniques with relaxation. And at the end, we do what we call the little dessert, which is you slather on the oil or the cream and just make it just delicious.
Yes, yeah. Well, going back to chair massage, I've been doing that also in different venues, and what really surprised me one day was going through an airport and seeing that being offered in these international airports.
Absolutely.
It just blew me away. I was just so happy, and I actually got one because I said I have to, encourage this. So
it's wonderful.
And the woman who was giving it to me, she said she's quite busy. She doesn't stop when she gets on her shift.
Absolutely.
They take 15 minutes, 20 minutes, sometimes longer, depending on it. If there's demand for more. If there's not a lot of demand one day, she'll extend a treatment, and it's great for travelers because we said they don't have to take off their clothes. They just take off maybe their jacket, and it goes directly on the clothes, and it's wonderful. Pause while you're waiting anxiously for your travels.
It's like giving you a boost of energy, eh?
That's right.
And did you know that there's around 7 hospitals in the Quebec region, in the province of Quebec, that use the massage chair for pregnant women? So they train the husband on how to work the points while the woman is pregnant. It's been shown in research that when a woman receives acupressure, for example, along the spine and certain points around the back, that it can reduce the I don't like the word pain, but the discomfort of labor by 47%. So, so when the woman's in labor, then the husband knows what to do. He can either rent or borrow a chair and work on the wife or the spouse as she's having her labor, and it makes it so much more, how can I say, smooth.
Yeah.
Even in reflexology, some of us are doulas, and we go in during the, we work with the woman before the pregnancy, and then during the birth process, we can actually help sometimes speed things up. There's anecdotal stories also about women who are trying to get pregnant and can't, tried everything, went for reflexology, and all of a sudden, they're pregnant.
Yes, or if you're trying to induce labor.
Yes, there's certain points you can press that are quite powerful, which is why when we have pregnant women as clients, we have to be very careful in the first 3 months.
That's right.
Work with great caution, not to press certain points.
That's right.
And
So people can go on to your various websites you mentioned and get some information about the different courses you offer and techniques, and they can, as a therapist, perhaps add this on to their bags of goodies. And as a client, come and get a therapy.
I want to say that many of us do home visits as well.
Oh, wonderful!
Yes,
wonderful.
I worked at the Manoir Knowlton for a while.
Okay,
and loved
they
my
must have loved you there.
Yeah, I love them.
Well, I just want to say thank you so much for being on the show, Carol. It was very, very interesting, talking about some of my favorite subjects as well.
Thank you, Ilia.
And for all you listeners, you can reach us at sunshinecenter.ca or 450-538-1111. Thank you, and see you next time. Bye-bye.